What's good, y'all? It's the Demouchets React, and we're back with another video. Who we got today, C?
Today we're back with another Australian reaction video. Super excited about this video, guys. If you're new to us and we're new to you, make sure you scroll down, hit that red subscribe button, and turn on the post notification bell because we're on the road to 50K. And we cannot get there without you guys, all right? Join the family. Without further ado, let's get into the video.
It's been a while since we've done an international healthcare system episode. We thought you might need a break. That break ends now. Australia has the only continental universal healthcare system, and it's the topic of this week's healthcare triage.
Top universal healthcare system. That's what you say?
Intercontinental.
Like pretty much every other country we've covered, save the United States, Australia has a universal healthcare system. It's called Medicare. What is the deal with that? Seriously, do none of these countries have a thesaurus or something? Medicare.
Everybody got it.
Anyway,
Everybody
Australia's
got it.
national public system provides coverage for citizens, permanent residents, and even many people with temporary visas. There's a program for visiting students, and even people seeking asylum get coverage while their cases are
under review. I like that. So there's a program for visiting students?
Yes.
Students.
Yeah.
Not people that's just visiting.
No, like students who's enrolled in their colleges. And,
Okay.
And I guess exchange students as well.
I think it would have been awesome if there's a program for people visiting too.
I know.
I think that would have been interesting because who says, the state may be a little wild and then the healthcare.
Like if you get in an accident or something
while you're out
on
there.
Vacation.
Yeah. Then you don't have to worry about calling back home to get your information to get to them. I don't know how that works. I don't know, but I just a thought.
Australia also has a voluntary private health insurance system, which complements and supplements the public one. It gives citizens access to private hospitals and some services not covered by the public system. The tax system incentivizes the purchase of private insurance for many individuals and families. Medicare also allows people to get free inpatient care in public hospitals, free access to most medical services, and prescription drugs. The federal government also works with more local governments to provide population health, mental health, some dental care, some physical therapy, and services for veterans. Medicare pays for somewhere between 85% and 100% of outpatient services. It also pays for 75% of the medical fee schedule for private patients who use public hospitals. Whatever isn't covered must be paid for by patients. Doctors can charge whatever they want, although incentives are in place to make bulk billing more likely for the elderly, poor people, children, and people who live in rural areas. Members of those groups also get a discount on drugs. Their co-pays on prescriptions are around $5.90 Australian versus $36.10 for everyone else. There are out-of-pocket maximums. When an Australian is paid out $421.70, then Medicare covers 100% of the fee scheduled for doctors for the rest of the year. Bad. When they reach $1,221.90, then 80% of all out-of-pocket costs are covered for the rest of the year.
That's not bad.
That's not bad. For us, for one of our co-pays, I think it was $2,000 that we had to pay, and then everything else was covered for the year. So far, it's sounding kind of like Medicaid. Yeah. For people who qualify for Medicaid and people who qualify for Medicaid and they have their private insurance as well, and they just use it to supplement or, exchange, whatever.
I don't think Australians have to qualify, though. I think, again...
it don't look like they have to qualify.
And they get prescriptions and all the other good things free.
Yeah.
It's a big difference.
Because prescription drugs is expensive.
It is expensive.
People in the special groups I mentioned before, the threshold is lowered to $610.70. Yes, that's complicated.
It's lower.
Thanks, Australia. There are also ways for families to pool such spending and to hit the limits faster. There are pharmaceutical subsidies for those who reach a threshold of $1,391 in a calendar year too for drugs. The threshold is also lower for those in the special groups at $354. Australia is one of the cheaper healthcare systems at 8.9% of GDP. Medicare is paid for mostly from general taxes, patient fees, and a 1.5% levy on taxable income.
It's good to know where their money going.
In 2010 to 11, the government funded about 69% of spending, 43% at the federal level, and 26% from states and territories. The rest, or about 31% of healthcare spending, comes from non-government sources. About 18% is out-of-pocket spending in co-pays or services not covered by insurance. Private health insurance accounted for about 8% of spending. About half of people have private insurance, which allows them more options in practitioners, hospitals, and care that they receive. Those who opt for private insurance before their 31st birthday get a reduction in premiums for the rest of their lives.
Oh, wow.
Each year, an Australian waits to start buying private insurance after they're 30 sees their rates go up 2% from a base rate, again, for as long as they live. Subsidies have been available to many Australians based on income since 1999. Most primary care doctors are self-employed and work in groups. About 8% of them are under contract with private agencies. Most work in a fee-for-service system. Most also get incentive payments for meeting standards set by the Royal Australian College of General Practitioners. In other words, they have a pay-for-performance system to try to improve quality. I know you watched that video, right? Patients can see any general practitioner they like. GPs do, however, need to refer them to specialists. Specialists also work on a fee-for-service basis, and many of them work in both the public and private parts of the system. After-hours care...
Okay, so far, I'm not really seeing much of a difference from our Medicaid. Y'all call it Medicare, but we call it Medicaid. And we do have Medicare that's for, like, the older, elderly. So I'm not seeing much of a difference. Here, we can't... Actually, if you have private insurance or Medicaid, I believe you can go to some specialists. It just depends on that doctor without getting a referral. So that's like really the only difference that I'm seeing so far.
Yeah.
Care is available either from primary care docs themselves or from private companies set up among various practices. Grants are available from the government to run after-hours care. Hospitals come in all flavors. In 2011, about 55% were public, 23% were private day hospitals, and 21% were other types of private hospitals. Private hospitals come both in non-profit and for-profit types. Docs that work in public hospitals are usually salaried, although they can work in other reimbursement settings when seeing private patients. Long-term care is mostly provided by families, with some people getting subsidies to help with the expenses. Some homes or care centers are available for those who are very dependent on assistance. Support is both means-tested and dependence-tested. The majority of long-term care facilities are non-profit. About a third are private, for-profit, and about 10% are run by the government. Quality is generally measured and reported on by the
Non-profit? I've never heard that.
I think he's about to play it back because
I
don't think he airs Fuji on that one.
Nursing homes? A non-profit nursing home? I've never heard of that.
I haven't. I don't think I have ever. I don't think I know one.
Oh, okay.
Australian Commission on Safety and Quality in Healthcare. About 85% of general practices are accredited against standards. And, as I mentioned before, pay-for-performance systems are in place to encourage better care. Some healthcare organizations and professional boards also have quality improvement programs. All citizens and permanent residents can get a personally controlled electronic health record if they want it. A fairly large amount of infrastructure exists to make such records interoperable at many facilities across the continent. Costs are controlled in a number of ways. The market uses generic drugs to keep pharmaceutical spending down. Almost all brand name drugs are bulk purchased by the government, which can also control pricing. New drugs have to prove their cost effectiveness before they're bought. Public spending is under global budgets, but as with some other
that's different.
This can lead to increased wait times for elective things. There are also broadly negotiated fees for many services. The knocks against the system will be familiar to those of you who are familiar with the series. Australia is worried about a shortage of professionals, but who isn't? In terms of quality, Australia sometimes comes behind some other countries we've discussed, but certainly beats others, like the U.S. The private overlay makes some people there concerned about a two-tiered system of care. It's interesting, though, that only about half of people opt for private insurance. Australia also has a disparities problem, with many indigenous populations having lower quality outcomes and poorer health than other citizens. But life expectancy is high, infant mortality is low, obesity is extremely low, and preventable deaths are rarer than a lot of other countries. And Australia does it for a reasonably small amount of money. In summary, Australia has a pretty robust public health care system with a private overlay that half of people use for better access and services. If that sounds familiar, it's because it's much like other systems we've talked about, including France.
Okay, that was very informative.
Yes.
You say, well, I gotta be extremely low.
Yeah, like you gotta make it extremely low. Nothing wrong with it though.
Sometimes it's extremely high.
And I don't think they have fast food chains like that will just contribute to them being obesity. I don't think they have heavy intakes. But the healthcare, bro, like, and another good thing that he mentioned is that the drug has to be proven to work before the actual person uses it.
And before they the pricing of it.
Before the price, yeah. That's big.
Yeah,
We just get stuff over the counter. Here you go, sir.
Yeah, so it was very, very informative. Again, I saw a lot of like similarities to the Medicaid program. I'm not too familiar with Medicare that we have. All I know is that it's like for the elderly, I think. So, yeah, a lot of similarities, a few differences. But the biggest difference is that everybody qualifies for it. Here, everybody doesn't qualify for, the government healthcare.
We got some great areas.
Yeah,
we do.
definitely. We hope you guys enjoyed this video with us. Like this video, subscribe, turn on the post notification bell. We have enabled our super thanks if you like to support the channel that way, as well as our VIP feature. If you want to join the family, join the channel as a VIP member. Check out the description box. We'll see you soon.
Peace.